Okay guys, today we're going to talk about the importance of vitamin D. So vitamin D has lots of roles, but my main focus usually is it being a prohormone, an insulin modulator, and an immune modulator. So this is why it's important. As you can see with this patient, his level was 59.3. That's good. The lab will tell you you have the option to go from 30 to 100 usually, and this is LabCorp. So a lot of people, I get them at about 20, and a lot of doctors will be like, if you're at 30, they're fine. Optimum number usually is about 50 to 60. If you have autoimmune disease, even higher, okay? You don't have to get to the 100, but your numbers need to be at least above 50 nanograms per ml for vitamin D, okay? Now, this is not a lab that's done all the time. You may have to request it. This is not an easy level to get up. You may have to, it takes a while to get your vitamin D up. So depending on the level, so sometimes for my patients, if their number is 20 or below, I put them on vitamin D3 plus K2, and that K2 part is important, 5,000 international units a day. And and then they take that, and usually it takes about 3 months for most people to get it up. In some cases, I even push it to 10,000 international units a day for about 2 or 3 weeks every day with food, because vitamin D is fat soluble. And then they can drop back down to 5,000 IUs. And that's what it takes to maintain it. Now, in the summer, people who are able to go outside, be in the sun, they can get enough sun and not need to take that much vitamin D. And that's okay, and it works. But for people in areas where you'll be surprised, even places like Texas, where you assume there's sun, but sometimes it's too hot and people don't go out. So even they have to take vitamin D in the summer, which is kind of unusual, but that's the case. Now, even more so if you're a dark-skinned person, you have melanin, because if you're black or you have melanin, you do need more vitamin D or more time outside or more sunshine than people of lighter or fair skin, because the melanin does block absorption, okay? So melanin is protective in a lot, but it does block vitamin D. So people of color, you have to really check your vitamin D, because they are usually chronically low in vitamin D. Why do you need it? Immune modulator. So if your vitamin Ds are low and you get exposed to a virus, a flu or whatever, you tend to be sicker from it. So vitamin D helps you not get as sick when you have in good levels. Talk about insulin modulation. As it helps with insulin modulation, I have noticed people with higher blood sugars or higher hemoglobin A1Cs, their vitamin Ds are also low. And in some cases, you correct the vitamin D and the sugar, the way the body handles blood sugar improves. So it's important that you have that number up. And there's also studies that show that it does help. It's a prohormone, and it helps how your hormones in your body work. So you may want to make sure that that is optimized in your body. Really important for your immune system, okay? I notice people with low vitamin Ds, they struggle with sleep, and they're usually very tired. And a lot of my clients, once they start taking vitamin D, not everybody, but some people notice it. Within about 2 weeks, the fatigue is gone, all right? So that's vitamin D. Insulin, that's a number that's not checked a lot as well. Everybody checks hemoglobin A1C, the 3-month sugar average. Insulin, to tell you the truth, you do need that number below 10 to be healthy. When I start seeing insulins of 16, 17, 18, it tells me one or two things. The patient is eating too many carbohydrates, and also their vitamin D may be low, which is why I'm discussing both of these today. So how do you keep your insulin levels low? Weight training or doing some muscle work, reducing processed foods from your diet, okay? Wheat, especially for some reason, and in the United States, is if you eat a lot of wheat product, simple carbs made of wheat, it does make that insulin go high. So this is a number that I don't see checked a lot, but when I check it, sometimes even with normal hemoglobin A1Cs, I see elevated insulins. And I see it in the levels of 20s and 30s in diabetics even. So I encourage my patients to keep their fasting insulins to about below 15, preferably below 10. All right, so insulin and vitamin D. That's what we talked about today, okay?